Welcome to the Paws Perspective.
The podcast where we help dog owners feel calmer, clearer and more confident by understanding what's really going on behind their dog's behaviour.
We're Pat and Molly from Flying Paws Dog Training, and each episode we break down behaviour, training and real life challenges in a way that actually makes sense.
From puppies and adolescents, breed traits and everyday training struggles, we focus on working with your dog's instincts, not against them.
Whether you're trying to prevent problems before they start or you're feeling stuck and not sure what to do next,
you're in the right place.
So grab a coffee, clip on the lead,
and let's get into today's episode.
Afternoon, Molly. How are we today?
I'm good. How are you?
Oh, not too bad. What are we chatting about today?
We are talking about something that I suppose we spend more and more time talking to clients about.
What's that?
The consideration of pain or the possibility of pain in our dogs.
Mm-hmm. And when would that be?
I suppose it's something we talk about increasingly more in behaviour consults.
Because of their behaviour?
Yes.
Mm-hmm.
That was a very close question. Yes is the only answer to that. They wouldn't be there asking us for help if there wasn't something. But it's something, we did a little episode last year on young Zani, who's not young Zani anymore. He's getting to be old boy Zani.
Still thinks he's young.
Yeah, mentally he's about 8 months old. And this, we should say, it's not a veterinary episode, but this is just why it should be.
What was if people haven't listened, what did we talk about?
Oh, his tooth.
And he had a little bit of a sore tooth, didn't he?
It's slightly more than a little bit of a sore tooth, but it makes you feel better that it's a little bit of a sore tooth.
Does it? He had to have it whipped out. And he was having some pain responses because of that.
Yeah, which we can talk about a little bit in this as well, but we won't completely. But we're going to talk about Zan.
Yeah, and Foxy.
Yep. And probably might be able to touch a little bit on Murph, but
Smurfy Murphy.
We'll get there. I suppose what we really want from this is for people to take away that behaviour is communication.
Mm-hmm.
And sometimes we have been taught as a society to just focus on behaviour, and we can train out behaviour, we can fix behaviour, but if we're not dealing with the cause, which might be pain, it might be emotions, it might be previous learning history,
Genetics,
there's a whole,
array of things
probably in that, but we're never going to better the dog. So we are just talking about pain today. So we will start, if people have not heard before, Zani is your 8-year-old Border Collie. He's always, I suppose, been very athletic. You have to use words in a podcast.
I was waiting for you to say that.
And what's happened?
Well,
in your big girl words.
I don't know whether I'm just thinking, have we talked about this before?
No.
Okay.
I mean, it's only been the last, I mean, it's been a month since you took him to the vet today.
Oh, is it? Gee.
Yeah, because
glad you can keep up with it.
Well, you had a hair appointment today and it was a hair appointment last time.
It was.
So
it's a good place.
That's the only way I remember it. But, which it was about, which was only a few days before
it happened.
Yeah, so anyway.
So, he's got a sore leg basically. So what happened was I was in the buggy, him and I were in the buggy.
Side by side.
Side by side, little buggy. And he likes to be on the floor and bark at it when it starts and moves.
Yes, we know that. And
then he jumps up onto the seat and watches out the window or does whatever he decides to do. So, he did that. He jumped from the floor to the seat. And off we toddled. I don't know what we were doing, mucking about in the buggy, went for a bit of a drive, came home, and a bit later in the day I took him out to do a little bit of a scent work practice, actually. And I thought, looks like he's hobbling a bit. Anyway, over the course of the afternoon.
On a back leg.
On a back leg, on his left back. And he progressively got worse. And by the end of the day, at times, he was actually holding it up and not putting it on the ground. So we thought, I thought originally he'd just tweaked something, as you do. We do it too if we move the wrong way. I thought it was just something like that, but he was holding it up and hobbling a bit the next day, so I thought I'd better be on the safe side, take him to the vet.
Do you want to tell people who may not have seen this on social media what your concern was? And to be fair, my concern when you told me.
Well, I probably wasn't as concerned. I was concerned.
Hang on.
It wasn't
Tell
what
the truth.
I thought. I thought that he just tweaked it, and then there was a lot of talk about he'd done a cruciate.
You said to me I took him to the vet because the first thought that came into my head was a cruciate. Yes, don't sit there and shake your head.
I don't think that was my first thought, but I thought I'd better take him because it might be a cruciate because he was hopping so much. Well, he was holding it up.
He wasn't weight bearing at all.
So off we toddled, and the vet said, yep, I reckon he's probably done it as well. So we had some pain meds, and it was, I guess, to be fair, we talked to, we know a few other people and you're one of your family dog, he'd done a couple.
Yeah.
So it was sort of...
There's only 2 to do and he did both of them.
We talked to people and it was, he
fitted the mould.
Yeah,
he's the right age. It can be a breed problem. It ticked a few boxes. So you booked in for x-rays after panicking about a few things.
Well, just how we were going to sort out everything with work. So booked him in, and off I toddled with me 20 pages of reading about what you've got to do with a cruciate, and came back and the x-rays were clear. And so they did some hip ones and they were clear. Perfect, actually, which was good. And the spine one was perfect and the toe one was perfect. So we ended up with a bit of a soft tissue.
So last week you went to physio with him?
Went up to Nicola. So the vet suggested doing a bit of rehab, which I probably would have thought about doing anyway. So we know Nicola, so we ducked up and saw her up at Canine Health and Rehabilitation.
Good job.
Excuse me, up at Railton. So we've got some massages we've got to do a couple of times a day and some exercises. And
do you want to tell everyone why you've completely missed the interesting bit?
Well, I'm just about to say that.
Oh, we should have started with that. Anyway, continue
with it. So he's got it's sort of a hip flexor issue. Well, I can't pronounce the correct
No, I can't
name.
either, but it's sort of a hip flexor issue. He has pulled or strained or possibly torn his hip flexor. Yeah.
So
which can be quite a painful
injury. It can be. I think, yes.
Well, I was just going to say it can be quite hard to rehabilitate.
Yeah, it's a little bit of an awkward one.
Yeah.
But I'm sure we'll putt along. But we're managing a lot of things, and we did straight away. You and I built a little pen for him, made it a bit small so he can't run around the backyard. So he's confined slightly when I'm not here, and he goes out on a long line, so he can't run around, chase birds or anything when he goes out to the toilet, all that sort of stuff. So we started doing all that sort of thing straight away because I thought, don't want him running around hurting whatever he's done worse. So
especially because I think too, and I probably didn't help the cruciate situation because I'm like, he's probably done a cruciate along with everybody else. But me and one lady in particular who has had some cruciate, she's gone through 2 cruciate surgeries with her dog. We both said to you that if he has done it, we think it would be torn rather than ruptured. So I think that made you manage things a bit more too, because obviously if it's torn, it can still rupture. Yeah.
So so we've been managing it. Been up, started doing our physio. So we will progress along with that. We'll keep doing that so that give him the best chance of a recovery.
Mm-hmm.
And I think, though, over the last couple of weeks, I don't think it's as sore as it was originally. I think he might, he's still got to be careful, but I can just notice a little bit of a difference in him.
He's still not, from my observation, I wouldn't say he's still hugely comfortable.
No.
Weight bearing.
No.
He's not holding it up, but today I could, it's his left, and I said to you, it's on the ground, but it's not really on the ground, and he's leaning on his right side.
When he's standing still. He still, when he walks, he does walk on it, and he'll stand on it to cock his leg to do a wee.
Although, interestingly, what has changed about his wheeze that you have noticed?
Oh, he has done some girl wheeze.
Can you not call them girl wheeze?
Well, they are. He's squatted to do a wee.
He does them all the time.
Yeah, well, well,
he only really cocks his leg if he's marking. Can we just call them squatted wheeze, please, and not be sexist?
Okay. He does some squatted wheeze. And I would like to state that Zan could do a wee with his leg cocked at 8 weeks old.
Yeah, because he's a cocky little shit. So it figures. But I think when you mentioned that on Saturday, I think that's interesting. And actually Craig said as well.
Yeah, because he'd never seen him do it, and he did it with him.
He was a bit shocked, I think, wasn't
he was. I think, though, interestingly, talking about pain and how it comes up in different ways, with his tooth, when he had his sore tooth, his behaviour changed, but it changed as in noises stressed him. And there's a particular, and I can't actually remember. I'd like to look. Can you remember exactly what month that was that he had his tooth?
December.
It was December, was it?
It was just before Christmas.
Oh, yeah. Okay. Good job remembering.
Well, that's because I'm 30 and you're 62, but anyway.
And you're almost 32.
Well, yeah.
You knocked 2 years off that then.
I did.
So what I
got
did,
away with it too.
Going back to Zan, what I did notice when he had his little sore tooth, that noise, he got very noise sensitive, and there's a particular bird type animal in the...
It's a bird, just call it a bird.
Well, I don't know whether it's a bird or a duck.
Bird. A duck's still a bird.
Yeah, but duck's a duck, a bird's a bird.
No, it's a bird. Just say bird and move on.
That makes a very squawking noise, but it's only first thing in the morning.
Yeah. And
it used to really stress him out. And I have noticed that noise is upsetting him a little bit again.
Yeah, okay.
So it's interesting that I think in a way, with some responses, I don't think his leg is as sore as it was, but it's still sore because he's still reacting to that bird first thing in the morning.
Can you just briefly describe how he's reacting when you say reacting?
I just stresses. He whines and whinges and looks concerned, and he'll sort of
trying to move away.
Yeah, he's trying to move away. And this morning he did it, and he came into the bathroom with me. Actually, laid in the bathroom while I had a shower.
Did he really?
Yeah, which he does. Could be because he went in one door and then the other door was shut, so he sort of laid at that and couldn't get out. But
couldn't he just go out the other door?
Yeah, he could have done.
I don't think he's that dumb. But
no, it was interesting that he stayed in there though.
Yeah, it is.
He was a little bit probably more distressed this morning than some of the other mornings.
Yeah.
But, and it only does it very early in the morning, and he's only stressed then, and it's only for a very short period. But
he also went through a period which was around the same time as his tooth. He didn't like when the smoke alarm went off.
Oh no,
he didn't like the air fryer.
No, he didn't. Not the beeping of the air fryer.
Yeah, the beeping of the air fryer.
Microwave he doesn't worry about.
Yeah, but that's been the same microwave since he was here. So, those sort of like higher pitch frequency noises.
And this bird is very high pitched.
Yeah. It'd be interesting, like if you got the air fryer out because you were cooking, not just to set Zan off, but to, just see if you were cooking with the air fryer, what his response was.
Yeah. So I just thought it's interesting, and this is where it's hard because you sort of, and you'll talk about it with Foxy too, you sort of know your dog and you can sort of, they're doing these things and you think, well, I haven't done it before, and they do change as they get older. And Zan's at that sort of age where they do have some little changes. But
he's a senior citizen now. It's 8, isn't it?
No.
I think it is.
No, what a load of rubbish.
When do dogs...
Not a senior citizen until he's about 14 or 15.
So when do dogs become seniors? 10 to 23 kilos, which, even though he's porky, he fits in that range. Why is that too small for me to read?
Because you're old.
Early citizen is 8 to 9. So he's an early citizen.
Yeah.
Classic senior is 9 to 12, so he's a year off being a senior.
No.
Yes, he is.
What a load of rubbish.
Continue.
Anyway, so, yeah, you do sometimes think at that age, is it just, a little bit of a change because they're a bit older? But you're not quite sure. So it does take a bit of working out, sometimes pain, because it doesn't just, it's not like us. You don't run around with a sore finger and go, ouch, that hurts.
You at the moment.
Yeah, well, it comes in different packages, I guess you can say, and you've sort of got to nut it out a little bit. So,
you do.
I just thought, this morning when I noticed, I thought, that's interesting. That bird's annoying him again. And, he's got a sore leg. So, interesting.
Yes.
So that's Zan's little story. So we will continue with him.
Just before we jump completely off Zan, I think it'd be also interesting to note the conversation that we had with the physio and why before, especially we move into Fox, it is important if you think there might be something to look at a whole team approach. And this is definitely not bagging vets out.
No.
But she knows the vet.
Yeah.
And she had a look at his x-rays.
Yep.
And he was like, I just don't know what's going on. And she's like, have you thought about soft tissue or ligament? And he's like, yeah, but I don't know. And it's pretty much as soon as you walked in, she said to us after she'd watched him move around, she said, it's exactly what I thought it was when he walked in here.
Yep.
So, and again, this is vets and physios working really well together.
Yeah. Yep.
So it's sometimes if you feel like there is something wrong and it's not showing up on an x-ray or it's not showing up in a certain veterinary traditional method,
try someone else.
It might be worth just
talking to someone
else and saying,
definitely. Yeah. It's like us. Like often, we go to the physio or we have a massage or we have the doctor, and a team is always good to work with.
And yet we both love the vet you went to. We've both seen him with different animals, so it's no disrespect to him.
No, the vet's awesome. I was really happy to have him, to be able to chat openly with him. He told me lots of things.
He's a veterinary surgeon, so it's that.
So he would have done the surgery if it was going to be surgery. So he was awesome. He explained everything. He was really good. Took ages. Actually, I was there for quite a long time. He took a long time explaining everything. I could ask questions, which is really good. Makes you feel better. You can,
especially for you that asks
lots of
questions.
But at least then you feel comfortable. You know what the go is.
Yes.
And the same with the physio.
Yes.
You can ask questions, find out what's going on. Like you just said, they know each other. So she checked his x-rays out, and then she sort of knew where to go once he got there. So, yeah, really good to have that team around you.
Yeah. So
that's big old Zan. What's the go with little old Fox?
What isn't the go with Fox? He, I suppose, is really interesting because I think on paper he is the last dog you'd expect to have any sort of issue because of his age.
Yep.
He's
only a bit over 2.
He's a bit over 2 now. He is quite fit, but there were a few, I'm going to call them behaviour changes, but I think for what some of them were, it probably sounds a bit, I'm going to say dramatic.
Well, they're changes in his behaviour, aren't they?
Yeah, but I think, and this is, I suppose, where they are very even though they've both got things going on at the same time, Zani is your typical dog was limping.
Yeah.
There was a problem.
Yep.
Fox was definitely a gut feeling that something wasn't right.
100% correct.
And it was looking at a few different pieces of things adding up to go, there's something going on. So I think one of the first things, I was thinking about this morning actually, one of the first things was I will always say to him, is he asleep?
Oh, I don't know. I can't see his head.
Okay, he might jump up in a second, but before I'm going to take him for a walk for the day, I will always say to him, do you want to go for a walk? And he must be asleep because he hasn't jumped up. Normally, you've seen him. He's like racing to the door, racing to the car, like, yep. He just wasn't doing that. He was starting to go a bit like, and I was like, it's weird. It's not normal. And then when we were on a walk, there were a few things that he would normally not have even paid attention to. Mainly motorbikes.
Yep. Which was noise again.
Yeah, which is all of a sudden he was like very stressed out about.
And it was a loud truck or something too, wasn't it?
Yeah, and it was like, this is not you. And I think it's really hard to explain, and I think we have clients that come and try and explain it to us, but you can say that and people will go, oh yeah, well something scared them, or and you're going, yeah, but it's not that. There's just
something.
There hasn't been a big, this is what's happened. And I think sometimes we say this to people all the time, we can get so focused on they haven't had a bad experience with a person, they haven't had a bad experience with a motorbike, they haven't had a bad experience with another dog, because if we've got a big, like we're limping with Zani, if we've got that, it's a clear picture in our heads, something's wrong.
Yeah.
And I think probably some of the issue with Fox too is it was around that adolescent age.
Yeah, which makes it hard, isn't it?
It does, and I think I was thinking we're just going through this last bit of adolescence. We've just got to, and I said to you one day, I was actually like slightly upset because I was like, he's not right. There's something, it's not him.
Yeah.
And what did you say to me?
Oh, heck no.
What did you say? You can't remember.
I said, what would we say if it was one of our clients?
And what would we say if it was one of our clients?
Go to the vet and get a check.
So I got Fox into the vet the next day, which very lucky I seem to be able to do that with the vet that we like. And he showed, I went and just told her everything. I was just like, bleh, to this poor vet. And she's like, I will just do a general health check. We will just, do the lot. And she was, I can never say this word right. Is it palpating?
Palpitating?
Yeah, where they're feeling them. And she was feeling down his back, and I could see in her face. And I went like, what? And she said, oh, just give me a second. And she did it again. And then she did it again. And she said, yeah, there's pain in his back. He's showing a classic pain response. And I think the funny thing is, what would you, if I came back and said to you, not knowing Fox, just imagine any other border collie, that they had shown a pain response in their back, what would you be imagining?
Yeah, well, you'd imagine that if it hurt, they might turn around and have a bit of a snap, or some might sort of just try to jump off the table or that sort of stuff.
Well, he was on the ground, but
run away, sort of.
He didn't do anything. What she picked up was the involuntary muscle contractions. And actually, one of the last times we went to the vet, I was holding him and she felt that area again, and I felt it. So this is where it does look so different in every dog.
Yeah.
Like, not to single him out and make him sound like a monster, but if that was Xana too.
Oh, possibly he would have used his mouth.
Yeah. Where he has proven throughout this process, he's very, and I really need to be careful of the words I'm going to use because I don't want to make it sound like he's just being compliant, but he is very stoic, the right word? I don't really know.
Yeah, I think and he's very, and he's very appeasing after you've done it, doesn't he? Like he wants to cuddle the vet or cuddle you, or
yeah. And he did it to Nicola, and we'll get to Nicola in a second. But he did it to Nicola on Friday when we went. It was just like, yep, that hurt, but I just want to give you a cuddle now because like he's almost like, I'm sorry.
Yeah.
But this is again where you would look at it and go, there's nothing wrong with him.
Yeah. Yeah.
I think,
and a lot of people probably, as you said, going through adolescence with what he was doing, you would have just thought it was adolescent and keep going and not done anything.
Yeah, just a fear period, late fear period, which is what initially I thought it was.
And also probably just before you get on to what you want to talk about, when I guess it's a little bit different for us because we, like Fox comes down here a lot where we're with our dogs a lot, where if you had
Fox probably spends, there's probably really one day a week where I'm not with him.
So for a lot of people that are working a normal 9-to-5 job, you know, you get up, you race around, off you go to work, you come home, you might walk the dog or play with it or do something, and then, you know, you got to do whatever you got to do, and then you're in bed ready for the next day. So a lot of people probably haven't got the time, not that it's their fault, but to actually really notice the things that you noticed.
And I think, again, we'll get on to, because he has seen 2 different physios for 2 different reasons, I'll point out. But one of them, the one we've been seeing virtually, Amy, who was on the podcast a few weeks ago, she said to me every time I say, I've noticed this, she's like, you're really observant. And I said to you, I think a lot of it is our job is to be observant of dog behaviour.
Yeah.
And there was a lot of things that once we got this, I'm going to call it diagnosis, but I'll get on to why I don't want to call it a diagnosis in a minute, that I, and we'll probably talk about this now, there was a lot of things that all of a sudden went, crap, this has not been a couple of month thing. This has probably been building for a while. The biggest one, the absolute biggest one was he used to shake his head all the time. Like they do when they get an ear infection. And Murph has had so many ear infections, it's not funny. So I'm very well aware of what an ear infection looks like. I'm like, he doesn't have an ear infection. And I'd say to you, like, maybe it's because his hair's quite long in his ear. Like, maybe that's irritating him. I don't know. And he would get stuck almost doing it, wouldn't he? And you'd have to really, like, redirect him. I was even at a point where I'm like, is this an OCD behaviour? Like, because border collies can get so OCD, but he doesn't show a lot of normal OCD border collie, like actually none. I can't think of one thing that he does that's OCD, and I'm like, shit, is this the OCD thing he's going to do? He went on the pain medication and it stopped. And I didn't realise it stopped until he went off the pain medication, because in a pain trial they will put you on it for a week or 2 and then take it off, and that's when it's the interesting thing I think about a pain trial is people will go, they've been on the pain meds and I haven't noticed a difference. It's actually when you take them off. But interestingly, there were a lot of things when he first went on the pain meds. But when he went off the medication, it was like that was one of the first things to come back. And I didn't give him any pain meds on Friday before our physio with Nicola. Because we tagged along you and Zan because, you know, to show him in what's going on without pain medication. And he did it nearly his whole appointment waiting for Zan, didn't he? So, you know, obviously he's trying to relieve something, realign something is irritating him, and the only thing he can do is shake his head. And it's one of the things we have picked up, both the physios and the vet have picked up on. It seems to be his left side, which sounds very broad and general, but he is okay. His neck, which was one of the main concerns, seems to be okay. He's okay with his left front leg coming forward, but not as much pushing it back. And he's a bit stiff in his back leg and hip. What we don't know with him is whether this is, well, we're assuming it's all connected, but what exactly the problem is. And I think we've potentially settled on the fact that we might never have something that's like he fits into this box. At the moment, we're holding off on x-rays. We're just seeing if some physio and some massage and things like that are going to help.
Yep.
But one of the things which I think is, I still do think is quite interesting, that everyone seems at the moment in general consensus of, is the biggest possibility is he has just grown too quickly.
Yeah.
His bones have grown too quickly for his muscles, essentially.
Yeah.
Which he's on the big side for a border collie.
Mm-hmm. So this does happen with other breeds, doesn't it?
It's more a giant breed problem, but it's not.
Doesn't mean that's only.
Yeah, it's not unheard of in other breeds. And probably out of everything that's been thrown around, because I think one of the things when you don't know what you're looking for, people throw around a lot of things.
Yeah.
This is probably one of, I'm going to say, the best but worst case scenarios. Best case because it's not something major and big and scary, but worst case because we don't 100% know, and it might just be something that has to be managed for the rest of his life.
Yep, but you don't know that either.
No. So it's your dog. Yeah, it's interesting because on the surface, I think a lot of people, even like my dad who lives with him, is like, "Are you sure there's something wrong with him?" And it's like, yes, there is. But a lot of people wouldn't actually know to look at him.
No.
He still goes for a walk. He'll still run around. He'll still go swimming. He'll still do all these things that he loves. Interestingly, I think it was the first or second day on the pain medication, he was back tugging with Zan, which obviously nobody can do that. Like Zan can't do that now.
Yeah.
But that was something that Fox had just stopped wanting to do. Zan would bring him up a toy and he'd be like, no, thank you.
Yeah.
And we thought that was because Zanny might have got a little bit excited and tried to hump Fox at one point, and Fox very much did not like that. But again, now looking back on everything, if he was sore and Zanny's grabbed him, you know, that it all these puzzle pieces are starting to fit in together.
Yeah, they are. Makes sense.
So, you know, it's interesting because this is where it really is like, we compare them a lot to show how different breeds can be, dogs can be within one breed, but like Zan's response to pain is totally different to Fox's.
Yeah.
But one thing I suppose all dogs do have in common, or I shouldn't say all dogs, but a lot of dogs have in common, is they do try to hide pain.
Yeah, they do. It's very, very hard to find, and if it is, they present it in so many different ways.
Yeah.
You've really got to be observant and watch little signs, and not just sort of shrug them off and go, oh yeah, no, that's nothing. Sometimes that is what they're trying to tell you, that they're in pain. So, and
I suppose this is why for a lot of behaviour cases, more and more we do suggest people go and get a veterinary consult.
Yep.
But I think the other thing that's really important is that you can have a vet say, no, they're fine, and there still be something wrong.
Yeah, that's right.
Because they can't talk to us.
No, they can't. And like you just said, they hide it. So if they go to the vet sometimes, unless it's sort of something involuntary like Fox's, where he just does spasm sort of thing, and you can pick it up, or Zan's hobby leg, sometimes they do hide it. So, you know, it might be a few trips or trying someone different or just, fiddling around until they do actually on that day they show something, and then the vet can go, oh, well, okay, what was that? Or, and move forward like that. But it is hard with dogs. It'd be a lot easier if they could just say, I've got a sore there, or I don't feel 100%.
And I think the other thing that's really important is we do tell you to go to the vet, not because we want you to spend more money.
No.
Because we are not vets.
Yeah, well, that's right. We're not.
We can't diagnose.
No.
We don't have the training that they have we have obviously some understanding of biomechanics of a dog and physiology of a dog, but nowhere near to the extent that
the vet does.
And there's a whole range of reasons why we might recommend.
Sometimes we need to get the pain under control before we can do any behaviour
And a lot of,
change work.
I suppose, a big red flag for us that it might be pain is a sudden onset of behaviours.
Yep.
But that doesn't mean we're not going to send you, or a good trainer shouldn't send you to rule things out.
Definitely.
And it doesn't necessarily mean going on medication, going on behavioural medication, anything like that, unless it's recommended. It's just, let's tick this box and then let's,
And sometimes a pain trial is good because then, you can see a bit more. Like you said, you can go on some meds, go off them, and see if there is some sort of pain there that's making a difference.
What I think was interesting with Fox was we went off the pain meds, as you do obviously in a pain trial, and we were all right for maybe a day, and then a few things started to creep back in.
Yep.
And it was a Tuesday, and I decided I'm going for a walk. I've still got a little bit of pain medication left. I'm going to give it to him. And we were, for people who obviously are local to the area, we were near the yacht club in Ulverston, where there's not a lot of room to actually get off the footpath, and the footpath is virtually on the road, which I know sounds stupid, but there's no nature strip, is there? It's on the road.
Yep.
And I heard a motorbike coming, and my brain went, really? And I thought, we can't move. It's coming down this way. He didn't give a hoot.
Yeah.
He just sniffed and walked and didn't even acknowledge this bike. And I went, right, I'm making an appointment to go back tomorrow.
Yeah.
Or when I could get in, it just happened to be that I could get in with the vet we'd been seeing tomorrow, and explained it all to her. And she's like, yep, let's just keep going. Whether we wean off pain meds, whether we have a low level of pain meds for us, I don't know. This is where we don't have answers.
But it's good to be able to have a good vet and talk to them and discuss it, and also have that other team around you that, with some massage and some stretches and the help from the physios, you might be able to get to a point where you can, but you don't know till the future, do you?
Yeah, and we went and saw Amy virtually, partly because I just didn't have the time at that point to put him in the car and go to Nicola. And it was a bit easier with the schedule the schedule I had, to just do a few virtually. And Amy has been amazing, and has, given me things to ask the vet. The vet's checked things, vice versa.
And this is where it's good to have a team.
Yeah. But being like, well, I've made an appointment with Nicola, and I was like, oh, shit, I need to actually do that. And she's like, just, if Pat's happy, come along with Pat. So I don't know. You didn't probably really have much of a choice. I was like, well, no, I said, do you want me to come? And you said you didn't care. So, you didn't care.
No. Obviously.
Actually having a massage, she massaged him, and you could see, to start with, he was like, no, this hurts. No, thank you. But by the end, he was nearly asleep, wasn't he?
Oh, yeah, had his tongue hanging out, and, he looked, it looked like it had given him a lot of relief, which, if anyone's had a massage themselves, it can hurt to start with, but once that starts to relax the muscles, it is very nice.
Yeah, and I think on Saturday, I said to you on Saturday, he just seems happier. And I don't know what you thought. You were with us on Saturday at school, but...
Yep. So, and again, it's probably that release of pressure, and it's just felt, easier to move, and just wasn't as restricted, and, he just was like, wow, this is pretty good.
Yeah.
So this is where you don't know where you're going to go in the future, really. You might be able to just have massages, you don't know.
Yeah, and I think the important thing, I suppose, wrapping Fox up slightly is, and again, he probably won't listen to this, so we can use him. We compare a lot of things to your husband, because when he has had, let's say, some medical instances, he has a lot less patience. He has a lot less emotional regulation. He's a lot harder to live with. And then he has whatever's wrong with him, and then he's fine again.
Yeah.
But it's exactly the same with our dogs, and if you've ever pulled a muscle or been sick in some way, or you have less patience, you don't have the emotional bandwidth, and especially this is, again, when we're talking about behavior change, we tell people to go and get some of these things checked off, because if you're in some sort of pain, it is harder to learn.
Oh, yeah.
You can't
be
push through that
bothered.
pain.
No.
It's harder to concentrate. So all of these things are exactly the same for our dogs. And I did say, and this won't be very long because it's definitely not as big as Fox and Zani, but Murph, like last year, got diagnosed with arthritis. I think when we talk about older dogs, and we won't put Zani in this category, but because you have a tantrum, but at 10, 11, when he got, like, he's 11 now, but at 10 when he got diagnosed for his breed, he is an old dog.
Yes, he is.
And you only saw him the other day. He's looking old now.
He's starting to look old.
We often just go, well, they're an old dog. And, there's a lot more now where we think about arthritis and pain for them.
Yep.
He's had a few different arthritis medications, natural, veterinary, all those sorts of things, and we've settled on a slightly more natural one that seems to be working for him. But I think winter has been harder. There are a few things as well, which means he can't take the anti-inflammatories now.
Yep.
So that has been a little harder to manage. But he is a very tolerant dog, and I think that's just his breed. So he, for a lot of people looking at him, you wouldn't even know.
No.
But he's very slow to get up and down, and all of these sorts of things that we just attribute to getting old. And like a preface, he is old. But we don't sometimes, well, I think we're getting better. I shouldn't say we don't, that, making them comfortable at that stage of their life needs to be a big priority.
Yeah, definitely. And seeing, and the vets have got a lot more
options.
A lot more options. There's a lot more natural things you can give them as well. And even just thinking about bedding and that sort of stuff. Is there something soft? Is there something warm for them to lay on, especially through winter, so that when they're laying, some of the beds now are orthopedic and things like that. It just makes it more comfortable,
And you don't have to spend a fortune like you used to on orthopedic beds. I picked one up for Fox from Kmart the other day that was like, what did I say, $80?
Yeah.
Compared to some of the orthopedic ones that are $300 or $400 for the same size. So, there's a lot more options.
Yeah, there is.
Now.
Yeah.
But I think in older dogs, if we see them and people are saying they're resource guarding or they're snapping or they're doing things that they've never done in their life, that is a big red flag for usually arthritic pain.
Yep.
But it can be some more nasty things that we won't get into too much here. But that is, again, why it's, the yearly vet check is so important.
Oh, definitely. And sometimes it's, not a yearly vet check. Sometimes it's 6 monthly. It's a bit like us as we get older. You need your bloods checked each year, and sometimes, it might be every 6 months just to keep a track on things so that if things do start to decline, you can get them early. Dogs are the same. Keep a check on them. If there's something there, you don't want them in pain for a year before you go and see your vet again. Keep an eye on them, make an appointment, go and see, have a chat to your vet. Most of the vets we've got around here are pretty awesome. So they're usually happy to discuss things and, see if you can make your dog a little bit more comfortable.
I don't know about you might have a different opinion than me, but what was that?
Yeah.
But I think this process in the last, even if we throw Zen's tooth and stuff in there, the last, let's say, possibly 12 months.
Yep.
I think it's shown that, like, even as professionals in the dog industry, we don't have all the answers.
Oh, no.
And even living with our dogs, we get people who feel so guilty when they've found out their dog might be in some sort of pain, or even if they're not and there's just a behavioural issue there, but it can be so subtle.
Yeah, that's right.
And it can be so easily missed even when you do know what you're looking for.
Oh, yeah.
And I suppose we don't want everyone to think that we're saying every behaviour problem is a pain problem either.
No.
But I suppose it deserves a seat at the table in discussions.
Oh, it definitely does. Yeah. But I think it's just important to know that it comes up in different ways.
Yeah.
Like it presents, and each dog's going to be different as to how they present a pain response, unless it's something specific like a sore leg or something like that.
Yes. Yeah.
So sometimes it is just seeing if there's a bit of a pattern with what your dog's doing, or just some of these pain trials can be very helpful.
I think it also is worth mentioning that, like, if you're listening and your dog's behaviour has changed, we don't want to just be thinking, how do I stop behaviour? Because we might be missing a massive big piece of the puzzle.
Yep.
Instead, we need to think, why has the behaviour changed?
Yep.
And if you can't pinpoint something, it may be worth going to the vet and
having a chat.
Because sometimes we can change training plans, till the cows come home. But if we can't actually, we don't know what the crux of the problem is.
Yeah.
It's pointless.
Yeah, that's exactly right. So, yeah, definitely. And I think that's having that team around you, trainers, vets, physios, everyone working together, makes it better for you and your dog.
Yeah.
Alrighty. That's a good one to discuss.
It's been a long one, but it's...
Yeah, it's interesting though, I think, pain. Definitely.
Yeah, and I think it's definitely warranting more and more of at least a conversation with a lot of things now.
Yeah. As everyone learns more about it and that sort of stuff. And I think we've learned a little bit more ourselves.
And I think involving more people, shall we say, necessarily, like I said, Fox, it sounds like an overload that we've got vet and 2 physios, but they're all doing slightly different things for me and him. And just even things like, when we went on Friday and Nicola's like, he's got a hump in his back, exactly where, before he'd stretched out, exactly where he saw. Or saying to Amy, which is something you'll go, I already knew all about this, the hair on his back, and she took one look at that and went, yeah, it's exactly where he's showing the pain response, isn't it? And it's like, yep. And the tightness of their muscles can affect the hair growth, and Zan's leg was a bit funny in a spot, wasn't it?
Yeah, it had a bit of hair sticking out in a funny way, and then as which I probably should have mentioned earlier, but as I think that it's not a sore, that piece of hair doesn't stick out anymore.
I think just actually, and this is probably a good place to finish on, I think one of the biggest things I've taken away from all of this, I don't know about you, but I think it's really reminded me that we can't actually say if we think they're sore or not. And that's not saying, like, I think Zan's got better too, don't get me wrong. Like I said, I reckon he's running it. If, let's say, he was probably at 30% when he was at his worst, I'd say he's like 50 to 60% now. Like, he's obviously not.
He's definitely not right, but he's better than he was.
But, like, I can't say that you don't have pain. You can't say that I don't have pain, and this is something that I think, if we look at it from that lens that, there actually may be something wrong there. We can't say it's good, it's bad, it's getting better, it's getting worse in certain ways. We have a lot more empathy for what they might be going through. Yeah,
exactly. Yeah, instead of they're just misbehaving.
Yeah.
All good. That was a good one to talk about.
Yes.
So if you've enjoyed this, don't forget to give us a follow, leave us a 5-star review so we can get out there and it can get to more people. And we will catch you on the next one.
Yes. Bye-bye.